What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, April 20th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Today, we have a shortened version of the pandemic update. Why? Because, well, there's not that much news to talk about today, but there is some data that I do want to share with you. And I think our last two news stories, which are kind of both about the same topic and in the same state, will take us over into some of that data that I want to look at. So, again, if you're new to the channel, subscribe down below, give this a thumbs up, and share this with anyone you know. First off, we've been talking about the solar eclipse lately, how that may cause a COVID surge. What we have not talked about is how it may further cause a measles surge to continue. But hey, there was exposure with measles at the solar eclipse. It says here, solar eclipse watchers at the Children's Museum, this is in Indianapolis, may have been exposed to measles. That's right. People who watched the solar eclipse at the Children's Museum of Indianapolis on April 8th may have been exposed to measles, Marion County health officials said. A person attending the event who traveled from out of state was infectious at the time and could have exposed others to the virus that can be highly contagious for those who are not immunized against it. So yes, measles. It happened in Indianapolis, and who knows? That's the only place we're hearing about. It could have been in circulation in other places during the eclipse, and you just did not know about it. So it's something that we have to be aware of. Then we come to this, and there's really actually two stories. I actually could not find a second story because I saw in the news yesterday a second part to this. Let me explain. Health officials investigating in whooping cough cases among children in Montgomery County, Pennsylvania. The second part of this is the fact that Chester County, Pennsylvania, is also seeing an outbreak of whooping cough at this time, and it's not the first time we have heard about whooping cough in the United States this year. We heard about it up in New York City area, Long Island. I believe we've heard about it on the West Coast. It's come up many different times this year, and it is something that we have to be aware of. It can also be known as the 100-day cough. So yes, this is something that is rather concerning. And something else that is concerning, although there may be some relief on the way. Massachusetts. We've talked about how there is a hospital capacity crisis really in a good chunk of New England. Rhode Island's no exception either. They have, Rhode Island is probably actually even worse than Massachusetts, but the eastern portion of Massachusetts is really bad. Well, there may be some help coming to that. Massachusetts General Hospital is adding 94 inpatient beds to address capacity crisis. There's a catch, though. It's going to take until 2027. It's going to happen over a period of time, and will they actually get more staffing for that? Can't answer that portion of the question, but this is definitely some good news. Let's go a little bit east of Boston area now, and we come to Cape Cod. Cape Cod is also approved to add 32 beds, which will help with the capacity crisis in that area as well. All right, let's take a look at some hospital capacity data from around the United States. We're obviously going to start off nationally and then talk about the Northeast, but we'll do something for not every state, but we'll do quite a few states. And in the United States, taking a look here, 75.3% of all beds are being used. COVID-19 makes up 0.9% of that. Influenza makes up 0.5% of that. And the ICU situation, 70.3% of all ICU beds are being used, 0.9% for COVID, and 0.6% is for influenza. Now, when we go up to Massachusetts first, you can see here, Massachusetts definitely continues to have a problem. 87% of all beds are being used, 0.9% is for COVID, 0.8% is for influenza. In the ICU at this time, 82% of ICU beds are being used. 1.1% is for COVID, and 1% is for influenza. Now let's go down to Rhode Island, because Rhode Island constantly has a problem as well. Starting off with ICU usage. Yeah, 86.2%. 0.1% is for COVID, 0.4% is for influenza. Let's go over to inpatient bed usage, and yeah, that's still at 87.4%. 0.8% for COVID, and 1.5% is for influenza at this time. And now let's go down to New Jersey. Remember, New Jersey hospitalizations for COVID have been decreasing. But what about the overall usage of their hospital system? Well, at this time, 71.1% of all beds are being used. Only 1% of that is for COVID. 0.5% is for influenza. ICU usage at this time, this is actually not bad at all. 45.4% of ICU beds are being used in New Jersey, and 0.9% of that is for COVID. 0.6% of that is for influenza at this time. Now let's go down, let's go further south. How about we go down to Louisiana, and you'll see in Louisiana, things are actually doing pretty well. 69.7% of beds are being used. This is for ICU usage. 0.4% for COVID, 0.4% for influenza. Taking a look at inpatient bed usage at this time. 67.8% is being used, 0.6% is for COVID, 0.2% is for influenza at this time. Checking out Florida, which has a higher amount of people that are older, because a lot of people that are retired move to Florida. In fact, all ages are moving to Florida at this point. Florida is rapidly growing, so let's see what's going on there. 75.5% of all beds are currently in use. 0.8% is for COVID. 0.4% is for influenza. ICU usage in Florida at this time. 73.5% of ICU beds are being used. 0.9% for COVID. 0.3% for influenza. Now let's go out to California and see what's going on there. ICU usage, 67.2% of ICU beds are being used, 0.7% for COVID, 0.1% for influenza. Taking a look at inpatient bed usage, 77.7% of all inpatient beds are being used, 0.9% for COVID-19, 0.2% for influenza, and I say we should do one more state. How about we go up to Illinois, up in the Great Lakes, and see what's going on there. 68.8% of all beds are being used, 0.8% for COVID, 0.6% for influenza, and what's their ICU situation? 63.2% of ICU beds being used, 0.7% for COVID, and 0.6% for influenza at this time. Taking a look at air quality data today, we can see the air qualities around the United States. They're really not all that bad in many locations, except Los Angeles. Los Angeles continues to have problems, and California in general. There's a lot of yellow and oranges. We can see a lot of green, though, in the Great Lakes, in Indiana, down through Oklahoma, Nebraska, South Dakota, North Dakota, Minnesota. Along the immediate coast, there is still some yellow here. That should clear, because there is a front that is clearing, at least down to about Virginia. Further south of there, the front's actually going to get caught up, so your air quality issues may continue. And Texas is also having some issues. New England, not doing too bad today. Taking a look at severe weather threats for today, there are none that we really need to talk about. There's just a marginal risk here in the south, and I'm not terribly concerned about that. So, not really much of a tornado threat for me to tell you about today, so I'm giving it a safe day today. Taking a look what's going on with pollen levels. Great Lakes, in through portions of the Mid-Atlantic, and at least parts of the Northeast. Red. It's a bad day. You want to be taking your allergy medicine, and if you're going outside, it's not a bad idea to wear a mask as well. Remember, the mask is good for allergies. Same can be said for the West Coast, where it's moderate to high, especially in the Pacific Northwest. Taking a look at EMS calls in Philadelphia yesterday. Just 674, so that is good. That's below 700, and it's not very busy right now in Montgomery County, so I'm happy to report that. Chester County is a much different situation. There's quite a few calls right now, as you can see here, but we're not seeing any that say respiratory emergency. We are seeing cardiac arrest pop up, so that is not good to see. Walgreens this week, 13% positivity rate. It's down 0.5%. They don't do a whole lot of testing. 4,875 total tests. 5,867 was the total amount of tests done last week. But again, the positivity rate, it continues to drop. Something else that I'm actually not terribly concerned about is wastewater. Wastewater at this time is dropping for the majority of the U.S. There's a slight rise in the Midwest, but I think we're going to see that correct probably back to lower next week. I don't think that's going to be a sustained rise at this time, but we'll see. Any individual site that has seen a wastewater increase as of lately has also started to go back down just as fast. So it's something we'll have to keep an eye on. But again, we'll do our full look at wastewater tomorrow. Tomorrow will be a dedicated video for wastewater unless some news actually pops up. Taking a look at some CDC data, and we can see with the CDC data, hospital admissions, 6,406 in the past week. They continue to drop, and that is down by 13.8%. Taking a look at what's going on with epidemic status for COVID, look at this. It's likely declining, or stable or uncertain across the entire United States. It's not growing or likely growing anywhere at this time. Neither is flu. Flu is no longer growing, which is some good news. Taking a look at New Jersey, 164 hospitalizations in New Jersey, with 60 out of 70 hospitals reporting. The number would be higher if the other 10 hospitals reported. 22 patients are in the ICU, 8 people on a ventilator, and 26 discharges at this time. New York State does not report on the weekends. All right, I do have a couple reminders before we end today's pandemic update. I know it's a short one. Though levels, they are much lower right now, you still need to mask anywhere you go. It only takes for you to come in contact with one infected person to make you become infected. And if you get a higher viral load, guess what? Your chances of developing moderate symptoms or severe illness increase. Please continue to mask anywhere you go. Please continue to use your air purifiers. Hey, some people, when they go to doctor's visits, they bring personal air purifiers with them. That is really a good thing. The lower we can get these numbers on our AirNet 4s, the better. Mine is currently saying 629. I have my purifier off at the moment. It's making it easier to record today. It's really windy outside, but you get the point that I'm trying to make here is the lower the number is on a CO2 meter, the better your air quality is. And anywhere you go right now, indoors, even outdoors, I mean, it's allergy season. You don't know if someone's allergies is actually COVID and not allergies. Did they actually take an at-home test? Chances are they probably did not. Many people think, oh, it's just the sniffles, it's just a cough. No, that's not actually true. There are people that are still getting severe cases of COVID. It's still a thing. It's out there, and you need to help keep yourself safe. Alrighty, guys, that's it for today's pandemic update. I know it's a slow news day, but I still wanted to get something out there to you. I could not just skip a day without giving you guys something. I'll see you all again tomorrow for our wastewater update. We'll go to all the different regions of the United States. Until I see you again tomorrow, stay safe, everyone. Give this a thumbs up. Subscribe down below if you want to see more content or you learn something. And, of course, share this video with anyone you know. Is there something I missed today? Leave a comment down below. I will see you all again next time. Take care, everyone. Stay safe. Have a fantastic Saturday afternoon. And thanks for watching. Enjoy your weekend.